Hey guys, today we are going to talk about the respiratory pathologies. And what are you gonna we see here? Physical examination, chest examination of the chest, pattern of breathing, and we're gonna see here inspection, palpation, percussion, auscultations. So let's go and let's start it. So what are you going to see examination of for the respiratory system during the pathologies? The appearance we're going to see dyspnea, trachea, muscles is going to involve during this breathing. During the inspiration is called sternocleidomastoid, trapezius, sacchaline, latissimus dorsi, intercostal muscles during expiration. In COPD, we're gonna see, especially in emphysema, there is a two types of COPD, emphysema and chronic bronchiectasis. But in emphysema, we're gonna see expiration issues. We're gonna discuss about it later about all details about COPD. But the key point you have to understand, there is no clubbing. There is no clubbing of nails in COPD. So nails mostly you can see due to the high level of vasodilators, especially tumor necrotic factor alpha. And what is the sign we can see here? Which other disease you can see? There's cyanide heart disease, uremia, bronchogenic and bronchiectasis, GI tracts, and neoplasmic issues. You can see this clubbing. So this is a key point you have to understand about it. And of course, if there is a respiratory issue, you're gonna see cyanosis. And cyanosis, where you're gonna see here peripheral nail, fingers, and plum. Mostly you can see here rhinoid, pneumonia, and hypervolemic. Here you're gonna see the cyanosis. And central, where you wanna see here face, lip, and lip of nose. So here you're gonna see the cyanosis. What about the fingers? So fingers, you say tar steering, mostly in COPD and bronchogenic. What about the wrist? Wrist, we're gonna see hypertrophic pulmonary orthopathy. In the short form is HPOA. So you have to understand this. What is it? The disease you're gonna see in the elongation of distal end of fingers. It's gonna be here, gonna be elongation of the fingers like that. What about the face? Face here you're gonna see, especially start with eyes, lower conjunctiva, pallor, anemia can cause low breathing. Flushing, mostly you're gonna see here, this is white heart failure. Neck, what are you gonna see here? Neck, of course, due to lymph node pathologies. Abdominal, what are you gonna see? Hepatomegaly or hepatosplenomegaly. And what are you gonna see? Liver toxicity. Edema, sarcal or pedal edema you're gonna see here. Before we go to the pattern of breathing, let's start with the examination, chest examination. So the chest examination, first we're gonna say inspection. So inspection, we're gonna see chest abnormalities. So the key point you have to understand about barrel-shaped chest. The barrel-shaped chest you're gonna see in COPD, especially in emphysema type, not chronic bronchiectasis type. And pigeon-shaped chest. What's the pigeon-shaped chest? You can see there's a chest here, and here the sternum is gonna be really like a pointed, like a pigeon, due to pectoris carinatum, and you can see here. And mostly it's caused by rickets and low vitamin D deficiency. And funnels, now we got the funnel shaped. Funnel shape, how it's gonna be? This is a chest, and you're gonna see the depression. The depression is gonna be inward. You're gonna see also here, it's called pectoris excavatum, local depression. And Harrison sulcus, and you're gonna see the development around chest. So your chest here, you can see the chest, and you're gonna see some kind of a development around here, and it's called Harrison sulcus. And now we're gonna talk about the spine. Spine mostly Kyphosis is like a patient is gonna be like forward like that, gonna be bended. This is called saphosis. And saclosis, oh, this is a really common problem by spine. It's like the patient, his backbone is gonna be curved like that. I'm not good in drawing, so just go with it. And now we're gonna see respiratory rate is gonna be decreased at 15 to 16 beats per minute. And chest movements, we're gonna see like a bilateral equal or not. And now we're gonna discuss the key points here. Normal male breathing, abdominal to thoracic, but abnormal breathing due to peritoneality. In female, normal thoracic to abdomen, but abnormal condition is gonna be why? Because of pleuritis. Pleurisity, because there is an infection in pleura, so that's why it's gonna be abnormal. Now we're gonna see palpation. The apex beat normally you can see in fifth intercostal space. Trachea pushed by the pleural effusion in pneumothorax, and trachea pulled by collapse or interstitial lung disease. These are things we're going to talk about all in the further topics. And normal chest expansion is going to 3 to 5 centimeter. If you're going to see less, mostly you're going to see the less expansion you're going to see in COPD, asthma, pulmonary effusions, and pneumothorax. Okay, now we see focal firmitus. Normal present by decrease or increase. Decrease in pneumothorax and increase due to fluid in lungs. So this is called palpation. Inspection. First we can see here precautions. Precaution, we can see resonant normal is a resonant, and if there is a hyperresonant, we're gonna see pneumothorax. If it's dull due to consolidation, collapse, or cavity, so we're gonna see this dull stone mostly in effusion. If there is a consolidation, a lot of mucus in the lungs, so we don't gonna hear too much sound, too much resonance. So that's a key point. And stony dull in pulmonary effusion. Auscultation, and that's a more really key important point you have to understand during the respiratory pathologies. This is a key point to understand, to help you to diagnose. So breath sound. So normal is vascular breathing. How is vascular breathing? You can see here the inspiration is higher and expiration is lower without gap. There is no rest between it. But abnormal, so bronchial breathing, you're gonna see here inspiration is gonna be less, and expiration is gonna be more, and with the gap due to collapse, consolidation, and cavitations. Now we're gonna see the sounds. There are 4 kinds of sounds you're gonna hear. For crepitation, crackling sound due to fluid. And how we're gonna see the fluid here? If there is a fine crepitations, cracking sound, you're gonna see pulmonary edema. Or cross, you're gonna see consolidations. Okay, now we see here, because of the cracking, this is a key point. If there is a cracking here in the lungs, you'll see here mostly consolidation, a lot of mucus in the lungs. Now we see rhonchi, the whistling sound due to narrowing of the airwaves. And where is the narrowing? We can see in asthma and also in COPD. Pulmonary rub, pleurisy, and pleural fluid. You're gonna hear in the pleural fluid, pleural rub. It's a rub sound. You're gonna oscillate. So this is also the important point for understanding. And vocal resonance. Vocal resonance, like vocal firmitus. So you're gonna hear when the patient is breathing, and you can hear this sound. So this is auscultation and precautions, palpations, and inspections. So now we see here there is some pattern of breathing, and there's special breathing patterns. We are going to give the name here is a Cheney stroke breathing. Cheney stroke breathing due to the period of apnea change into hyperapnea. And hyperapnea breathing in between the 10 seconds, and if there is breathing pattern less than a 10 seconds, it's called hyperapnea. And mostly it's caused by the brain injury and strokes. And Casimir breathing, rapid breathe when the toxin in the body. Ataxic breathing, irregular in time and breath. It's gonna be fast and irregular due to brain injuries. And hyperventricular, fast breathing due to panic attack and aren't respiratory causes. So these are key points about the pattern of breathing, and these important points you have to understand by PMC exam or point of view. So this is for today, guys, and later we are going to talk about the COPD, emphysema, asthma, all the diseases we're going to discuss about. So